right, we are out there. It looks like we've got folks funneling in. So good morning, afternoon, depending where you're at in the country. We're going to start in just a moment with our virtual fireside chat here on patient experience. Again, we're just going to wait a quick moment here as we get everybody funneling into our Zoom here. And then for those of you that are joining us on social media, we won't be able to get to those questions and comments today. However, please, if there's questions, we'd love to follow up and circle back. So please feel free to type questions, comments you may have in the stream, and we'll certainly circle back as we go through that. I also, as we're waiting for everyone to join, those of you that are in the Zoom with us here, any questions that you may have, we will do a Q&A as a part of our conversation today. So there is a Q&A button on the bottom of your screen. Please feel free to submit those questions at any time as we're going, and we'll make sure to dive into those as we go. So just for time's sake, I'm going to go ahead and get us started. So really excited for you guys to join us this fireside chat on a topic that I think is, really started getting some momentum, and I think now is even more critical as the healthcare industry has completely had to rethink operations. They've been dealing with things they've never dealt with before. So a really critical time when you look at, again, patient experience and healthcare operations. So I'm really excited to have Toni Land and Jeff Rosowski from Medallia here with us. What's really unique, they serve on the healthcare vertical with Medallia, but they've both been practitioners as well. So the perspective that they're going to be able to bring, not only from a strategic lens over some of the tools, trends, themes that are going on, but they've actually sat in the shoes as practitioners to understand what that actually means for implementation and driving this within an organization. So Jeff, Toni, really excited to have you for this chat today. Thanks for joining us.
Thanks for letting us participate, Greg. Appreciate the opportunity.
Of course. Toni, let's start with you. Why don't, for those that may not know you, give us a little bit of your background, walk us through your path and what it is you're doing now with Medallia.
Okay, so for those who don't know me, I am Toni Land. I'm a nurse for over 32 years, and I've been blessed to work in many different arenas. Started out with a passion around pediatrics and oncology, and so lived in that world for a long time and sat in many roles that many nurses have, manager, educator, some of those roles, and then branched out into the medical practice setting and managed a PT clinic for a while. So that was definitely very interesting and a whole different world for me. And then started working on some operational improvement. That was back when I was at Novant Health and working on some operational improvement, which then took me into patient experience proper. And once I got there, I just felt like I was home. I mean, it was definitely the place for me. It resonated with me. And so I've kind of been living in that world for the past 12 years, give or take. And most recently was Chief Experience Officer at an organization in West Texas. So now, if I can just add, I'm now part of the Medallia family. That's how Jeff and I know each other. And I'm new to the family. So I've been in the family this is my 4th week, so a month now. So really new, learning lots, and just excited about how we're going to be able to transform healthcare.
That's fantastic. So being so new to the organization, I may throw some questions at you towards the end, understanding what it's like onboarding onto a new organization in a crazy time, right? Okay. So be prepared for that. That just kind of struck my mind as you were mentioning that. Okay. Jeff, kick it over to you. Give us a little bit of the same. Talk us through your background and what you're doing with Medallia.
Yeah, sure. So Jeff Rosowski. So I've been a physician assistant for 20 years, born and raised in Buffalo, New York, and moved to Raleigh, North Carolina after graduation. Started my career in a outpatient hospital setting, doing inpatient work, outpatient work, urgent care work for a few years. Transitioned to pharmaceuticals. Medical device, back to clinical work in pain management, part of a startup organization in the diagnostic reference lab space. Had a stint at IBM, their Watson Health division, and joined with Medallia last year. So a lot of various experience, both, and I'm still a practitioner. I still have my license in North Carolina, but recently relocated to Newport Beach, California. And so here we are now during the middle of COVID. and perform that task with a corporate relocation for my wife's company.
Excellent. Fantastic. I think to kind of tee up the dialogue, I want to follow a little bit of a timeline here. And when you think about patient experience, having grown up in hospitality myself, there was a lot of conversations that we've been having over, I would say, the last 3 to 5 years, where it seemed hospitals and healthcare organizations really started, benchmarking hospitality, what's going on in hospitality. And we started doing the same, frankly, because there's a lot of similarities in just the business operations. You've got folks staying in your physical assets, your properties, which is a huge element to that. But where do you think the concept of patient experience really started stemming from, and why did it start getting such a focus across hospitals and healthcare communities?
Yeah, so I'll start off, and then Jeff, if you want to chime in. So I think there's many different perspectives on that. I think, back in early to mid 80s, then I think some of the start around it, Greg, just kind of like you said, was around that hospitality, the satisfaction piece. Did we meet your expectations? That was some of the start around it. And then I think we saw a shift, maybe an addition, maybe a shift. It depends on how you look at it there. In the 90s, where CMS got involved around CAP surveys and HCAP surveys, those different surveys, which were more of a outcomes and quality metric. So then I think we end up now kind of having this marriage around, yes, quality outcomes and questions that kind of get to some of that aspect, but then the portion around truly patient experience, patient satisfaction, and are we meeting the expectations of our families is one perspective on that.
Jeff, I'll kick it to you for your thoughts here as well.
Yeah. And I agree with Toni, and I think there's been more of a focus on experience, given the fact that patients nowadays want to have a Amazon, Target, Hilton, Marriott like experience, to your point, Greg, earlier about hospitality. And so I think that patients are viewing health systems now just as a whole, instead of siloed portions with billing and inpatient services, outpatient services. And so, when those things go awry and, it's not up to the level that a patient would expect, there's a lot of disruption occurring right now. There's, you're no longer competing on a local scale. Incumbents, that have been giants in retail are now opening up clinics in multiple states and, charging, nominal dollar amounts for full physicals and $1 a minute for behavioral health. So I think that, there's that aspect of it is changing the game in healthcare.
Yeah, it's interesting and I remember in hospitality, with the conversations and benchmarking the two organizations, in hospitality, certainly you have people who choose to come to stay at your building and interact with you from a, leisure standpoint. And you think about someone who's staying in a hospital may not have chosen that visit, right? So there's an even elevated, I would say, level of care and emotional understanding that plays into this concept, and making people feel comfortable, welcome, cared for is critical. When you think about, COVID has certainly put a lot of organizations in a very difficult place. It has made businesses of all industries have to rethink almost a forced digital innovation as they or digital transformation as they go through COVID and the pandemic. With a lot of customers looking for contactless experiences, restrictions on how we're doing business. When you think about healthcare organizations, hospitals, what do you think are some of the top 2-3 areas of focus that you see healthcare organizations focusing on today, whether it's technology or patient experience mid-pandemic? What are the top 2 or 3 things that you see are currently happening? And then we'll dive into what do you think should be a focus here in a little bit.
You want to start, Toni?
Sure, I can. So I think there's lots of things people are trying to incorporate to help patients and families feel safe, and of course while keeping employees safe also. So I think we've seen an increase in online scheduling. Something, you know, as I would say, simple. Some may consider that simple, even as simple as that. And I think higher utilization from family members also that maybe we weren't using in the past. You've got the touchless check-in. We're seeing a lot more of that in our med practice, urgent care, ED settings, where we're decreasing the amount of people that are in a waiting room, and some eliminating that at all altogether, and really having that touchless check-in, which I honestly think is a win. That patients aren't having to sit in a waiting room as long. They're able to go back quicker and see their caregiver quicker. Telehealth, virtual care, I think everybody knows how that has just skyrocketed, you know, across the country. So those are a couple kind of right off that come to mind for me.
Yeah, and to piggyback off of that, we're having conversations with health systems regarding a virtual contactless check-in for telemedicine, because to Tony's point, health systems are getting inundated with appointments and telemedicine visits. And so, how do these systems respond to that incoming call volume and incoming request to schedule an appointment for, non-COVID related symptoms, whether that's chronic disease management or, other afflictions that they have. And so, there's been, discussions around 2-3 hour wait times. And so somebody's waiting around from a Zoom meeting or a telemedicine platform meeting for that long. And obviously, they want to be there when the provider shows up to that visit. But, having alternative methods of communication where you're meeting the patient in the communication style that's most relevant to them. As a father of 3 children, getting pulled into online learning, and my daughter just came in and told me she did well on her math test that we studied for until midnight last night. So yeah, exactly. So it's those types of things where I can't pick up the phone or wait by a computer to have that. So when we're ready to see you now, send a quick text message that's, bi-directional communication. I think that, those are opening up. And, to Tony's point about, family experience as well is, when folks are isolated in an ICU or an inpatient stay, how are we opening the doors for, communication that way so they don't feel like they're in solitary while they're, recovering from, heart attack, strokes, COVID, even non-COVID related situations.
Yeah, if I can I just add on to that, Greg? So I think that, Jeff, you ended around the whole visitation piece. And I think that has been a huge pain point in healthcare is, during this pandemic, not only on the COVID isolation unit proper, but many organizations have gone through periods where visitors haven't been allowed at all. And so then you had these, patients that were in the hospital, no loved one at the bedside, and just the challenges not only in care, in education, in communication. And so they've really had to try to look through what are our technology options? How do we connect families virtually, whether that's, some were using FaceTime, some were using Zoom, just different platforms where someone could go in at least virtually. You could be in touch with your loved one, but that's been a huge challenge.
I'm glad you teed up on, or actually went down that road, because one of the things I wrote down as you were talking was family members and the lack of visitors, and how do you manage that very emotional experience, right? People who are, in the hospital looking for support, and people who want to support someone and their loved ones and their family members. And it's, talk about an emotionally draining and challenging time. I think let's touch back on that in a second too, because I think that's, the emotional side of the healthcare industry is something that should really be top of mind for folks. And it's not just a transaction. You're not just going in and, going for a procedure. There's a lot of emotion that ties in there. And I think there's a lot of opportunity there as well. When you think about, there's a lot of, again, groups that have done digital transformation. They got ahead of the curve when it came to everything that's, shifting business-wise. There's still, I would say, probably organizations out there that are figuring it out as they're going. They haven't had the time because they got inundated with a lot of volume on something that, they weren't expecting. And frankly, the world may not have been ready for at the moment. if you had to narrow down 2 to 3 areas that, if an organization may not have, mapped out everything the way you haven't had time to actually do strategy, as you look forward, as we go through the rest of this pandemic and even post-pandemic, what are 2 to 3 things that you would say from your opinions that, every healthcare organization should make sure these are top of list as they start building, their strategies and their tactics, A, rolling out of this, but B, as they continue to move forward?
Yeah, I'll start on that one, Greg. So I think that, to your point earlier, the digital front door is becoming more and more important. And so when we look at, some of the retail and hospitality folks and, how they're designing their website for feedback and for communication channels, very, very simple things to listen to patients, when they're coming onto your website, whether that's through an online patient portal, whether it's a bill pay aspect of it, or just if they're looking for, a telemedicine appointment. And so being able to identify that aspect of, your communication with patients, I think is important. And then secondly, as telemedicine becomes, normal now, and reimbursements, I believe, are here to stay. I think having the ability to collect feedback from those telemedicine visits and video capabilities, text messaging right away, not only from the patient perspective but provider perspective, what's working well, what's not, are things crashing, or are they having to use FaceTime on their personal phones to reconnect with patients because of IT issues. And so, when you're looking at things, from an inner loop effect situation affecting ones or singles or tens, to outer loop affecting hundreds, or if not thousands, depending on the size of the organization, being able to identify common themes, trends, aggregate that information, and then, democratize it to the organization. I think, so those 2 things with the digital front door, listening there, instead of having a feedback email that goes in this one inbox where, people check maybe once a week or where the case may be. I think there's some, definite improvements that can be made across multiple health systems that we're just in discussions with.
Yeah, I would echo that definitely. I think most would say telecare, telehealth in some aspect, it's here to stay. It's not going away. And if you're, not currently up to speed, what does that look like for you, and how do you continue to advance that, not only for patients and families, but also for the health of your own team members? And how are you going to use that tool to improve the health of, those who are you employ to come in and serve every day? So I think you have that patient and family aspect, but you also have that employee or team member aspect. And so how are you getting that continual and constant feedback from them also, so that they're a part of the change, giving those ideas? They oftentimes know what we need. We just need an opportunity for them to give us that feedback. And whether via the text message or whether it's an always on type before platform, so that they can give that feedback. And how do we make sure we're keeping them healthy? I think we've seen during this pandemic, whether it's burnout, whether it's resiliency, whether it's moral distress, that it's impacting those who actually come in to serve families. And so how do we really dig into that aspect also?
Yeah, and I think the point you just made too, in getting that feedback, whether it's always on type of, collection tool, text message, in moment and as it's happening, is important. Not necessarily just a once a year employee feedback solicitation through a survey. That in moment and that real time aspect is so critical to actioning change quickly and actually making a greater impact, not just for the employees, but your patients and customers at the end of the day as well. Jeff, I forgot to ask, your daughter's math test, was it the new math or the old math? Because I've started seeing all these different videos on the new math, and I'm completely baffled.
Man, I had to go through the old school division ways to kind of make a point and, create fraction lines for, calculating surface area and volume. And so, of course, these are topics that are, far removed from my memory banks. So, fortunately now I have Google to rely on. A quick, area equals, base times height divided by 2, man. So same concepts, but, a couple things they teach differently now.
Yeah, I think I need to do one of these chats with some educators on the differences between old and new math, just as a refresher or a 101 guide for everyone at home. When you think about, the digital touch points, the, tech integration, hospitality, I'll start there real quick, has always been a the bedrock principle. And I had Shannon on yesterday talking about tech in hospitality. And, how do you find the balance? Because hospitality's been always about, in-person service delivery, high levels of personalization and, people-oriented service. What's the balance look like? How do you find the balance between digital service, in-person service, finding the magical mix where people don't feel it's too robotic, and then it's impersonal, but there's still that kind of humanistic touch to it. How do you find that balance in the healthcare industry?
That's a hard question. I do think I think that balance looks different for different organizations and different service areas. And so I do believe in healthcare. Digital absolutely has its place, and it's the wave of our future. I mean, I say our future, I think we're already there, but we're not going to go backwards. There's some things that we're never going to go back to the old. So hopefully most of us have moved past that. But touch is also part of healing. And so there are some aspects of healthcare where touch is appropriate. And so here again, kind of to me, it's going back and truly hearing from the communities that I'm going to be serving and really finding out what's that right balance. I may be in a community where people are not as technologically engaged. And so how do I find a better balance for them where I may have another organization where maybe, and I'm just using it as an example, maybe they're a little more urban, maybe people are more tech savvy, they're engaged in their technology, then my balance may look different then. So I think it's truly hearing from the customers that we're going to serve and then building to meet their needs.
Yeah, and I think that, with the previous model of heads and beds is just transitioning more into this healthy balance of from a procedural perspective or surgical perspective to where the follow-up now doesn't have to be re-engaged on site at the hospital. A quick telemedicine visit can see how the patient's doing, make sure there's no redness, discharge, whatever the case may be. Maybe some obviously a convenience factor for sure from a patient perspective. If you're living in an urban area in, San Francisco, New York, Boston, any place from a traffic perspective, you can waste half a day just from travel time alone. And then time off of work, if you have kids, to take those folks. And so I think that as this matures and, models become a lot more succinct and definable, for sure going forward.
Well, and how do you give people options? Kind of, Jeff, to your point, I mean, I'm a mother of four. I mean, yeah. There are times that I would have wanted an option and I may have chosen a digital or virtual platform versus getting my crew ready and getting everyone out, to a doctor's office. So I think giving people options.
Yeah, and choosing the vehicle in which they're most comfortable or what's convenient, for them in the moment, their preferred method of communicating. We're getting some really good questions that I can't wait to dive into here in a moment. And I'll save a comment for that. As you think about, again, I've been a raving fan of Medallia and technology, and you guys continue to grow and continue to build, acquisitions, bringing on new technology. You're doing that, it feels like, every week. When you think about the tools that Medallia has out there to help with some of these use cases and some of these touch points, can you give everyone who's joining us who may not know Medallia as well, what are some of the tools that you guys have at your fingertips to be able to help an organization manage through some of these tactical areas or these strategies that we've been discussing here a bit, or others that we may not have dove into?
Yeah, sure. So I'll tackle that one since Toni's 4 weeks into her Medallia onboarding experience, because we have made a lot of acquisitions recently. So real-time bi-directional SMS text messaging platform, and these are all under the Medallia quote unquote experience cloud, right? So we have our base platform for customer feedback, digital feedback, employee feedback. That's our bread and butter for the last 20 years. And so when we look at these acquisitions and how they transition into healthcare, again, SMS, Zingle was an acquisition, Votu was an acquisition, Strike Deck for B2C purposes, identify areas of customer retention and, why folks are leaving and why, why they're staying. Speech is a big one that we just went into with the most recent purchase of Stella Connect, and prior to that, Voci. So imagine, disparate or centralized call centers within hospitals and healthcare institutions, to where, instead of recording the calls and picking out, 5 or 10 of these calls, all that information is coming in, providing, emotional tone, sentiment, features, and coming into the organization, where you can identify, again, common themes and trends from every single phone call that we're able to transcribe in real time. And then again, there's all sorts of QA/QM aspects for that, from agent coaching, reduction in, and that oversight, as well as opportunities for self-coaching, and a really cool one that we purchased is Living Lens, which is a video feedback platform. So imagine a situation in a telemedicine visit, to where the provider and the patient have completed their visit, and then a survey comes up where you can give the option to record a video feedback, and then we're again taking in facial gestures, object recognition, sentiment throughout that feedback, to see what went well, what didn't go well from a provider and patient aspect, and then again aggregating all that information into one centralized platform. So Medallia is is simplest form, is a centralized customer data platform. So we take in not just the survey feedback, but 80% of our data comes from our integration points and non-survey data. So we look at health systems and their disparate systems with, EMRs and CRMs and, ITSMs. So that's what we do in a nutshell.
I'll just chime in very briefly. And it was one of the things that really drew me to join the Medallia family. So, I'm in healthcare for 100 years. I've got data. I've got plenty of data. But usually it's lag data. It's not anything that I can get where I can actually feel like I can use it real time and make a difference for my patients, my families, for my team members. And so to know that I could get it here on my mobile device, when I'm out and about with my families, out with my team members, I can see comments on here real time. I can engage with team members. I can engage with families. For me, that was such a missing piece in my, in my experiences so far in leadership. And so for me, that was a win.
You look really great for having been in healthcare for 100 years.
This is back-to-back meetings on 2 days that Toni looks awesome, and she's gotten that comment. So I'm glad you brought it up, Greg. And I have a it's going to be a repetition for sure.
That's great. That's awesome.
She started small.
I was thinking too, and we'll dive into the Q&A here in a second, but even thinking through some of the other touch points that, knowing some friends that are in the industry as well, when you think about health coaching, and, when you discharge someone out of an emergency room and they come back within a certain amount of time, I mean, there's insurance companies that aren't, you're not getting paid if it's not done right the first time, and you're, having repeat visits and helping make sure people are taking medication correctly and looking for, symptoms to look out for, things to be aware, can all be done through a digital touch point as well, and helping be a partner and a coach to a lot of folks who may need that as they're coming out of recovering or going through various challenges. So one other kind of use case I think through the journey that's a lot of potential as well. When you think, let's dive into Q&A, because there's some really good stuff. I'm going to try to do this in an order here that we kind of go into a flow. So when you think about, you talked a lot about technology. So the question is, you may have chat features, call features active today. Does text messaging work if you have these other channels already open? And how do you see text messaging adding value alongside of these other platforms or other channels as well?
Yeah, sure. So if I'm reading the question as well. So I'm assuming with the question that the chat feature relates to a website, and call feature, I'm assuming is outbound. And again, I think that, it goes back to the points where studies show that, there's a 98% open rate for text messages. And so chat is going to take a lot of interaction. And, I had an experience the other day, a non-healthcare experience, but it took, I just got a response today from 5 days ago through a chat window. And then somebody else's, system was crashing. So I think, and that can happen with anybody, right? But I think that having, imagine a nurse in a ambulatory surgery setting who has to perform outbound phone calls, or even in behavioral health settings with payers, these outbound phone calls are occurring with, 5 to 10% capture rates. And so if you get an open rate of 98%, and, you're meeting that patient where they can respond at that point and then interact with them real time on the other end, I think that provides tremendous value. And then, from again, an ambulatory surgery perspective, pre-surgical instructions, day of surgery, anything occurring, real time right away, getting back to that patient. Then obviously, a couple of days later, make sure there's no problems in there following post-discharge instructions. So I know a lot of hospitals have maybe, a one cell phone that a nurse gets, and which is great and fantastic. But take it a step further where, you're getting all this information now in a text messaging platform. That information gets pushed automatically to the EMR. So it's less documentation for those employees. And then again, with common themes and trends that we can run through our AI and NLP and then take action on it, we're going to be able to identify operational inefficiencies.
Yeah, completely. And I think the one thing just to mention, having run CX in a different industry with a lot of similarities, is just the ease of opening a text message, the convenience of not having to go into an app or go into a website to go into that chat feature, or potentially sit on hold and you're stuck on the phone and not being able to multitask. If I'm already engaging with people via text message and I can just add you into that list of people that I'm engaging with, it's much more convenient to do that.
And if I don't recognize the number, I'm not picking up the phone because it's somebody asking me for my social security number.
Correct. Or you've been tapped to receive a check from someone overseas, right? To put into a bank account.
I got 4 million on the way, Greg.
That's awesome. Good for you. Good for you. When you think about the healthcare industry, whether you want to mention who's doing it well, right? When you think of hospitality, there's brands that stand out as far as, high levels of service. You have the Peninsulas, the Ritz-Carltons, the Four Seasons, the you name it out there. Do you see brands that are just knocking this out of the park? And if it's not necessarily a brand, what is it that the brands are doing to be a thought leader or a driver in this, patient experience space?
Toni, you want to start with that one?
Yeah, I'll start with that one. And not to say that I know, who's the Ritz-Carlton, so to speak, and in the healthcare realm, but I think those who are on a positive journey and really seeing improvements and change are the innovators, are the ones who are really want to listen, and not just to have the data and to have the comments and feedback, but to actually act on that. Those are the ones that I feel like are the higher performers. They're willing to step out there and try something new, not knowing always if that's going to actually be the thing that works for them, but being willing to try that, knowing that if it doesn't, we'll step back and punt, and we'll try something different. But those are the organizations that I feel like are excelling in patient experience.
Yeah, and there's a cultural element to this too that's really critical, right? And having been in multiple organizations, having consulted with multiple organizations, if you don't have that cultural buy-in from the leadership team, that this is important and we're actually going to deliver on this, and we're not just doing lip service to the fact that we want to hear our customers and our patients and do something with it, and our employees, that's a huge piece to being successful here. And I would agree with you, especially those that have the leadership commitment to execute on that, or those that are going to absolutely knock this out of the park.
Yeah, and I'll identify one healthcare provider and system, and that's the largest in the country, is the VA. I mean, we all know what happened with the VA 5 years ago in Phoenix, and so the VA had a tremendous problem with trust. And so from then, and having that leadership and ability to kind of step outside the box and try something different, which they did with us with Medallias. Fast forward to today, they're over and hovering at a 90% trust rate from 60. And so you look at that improvement, and they're outpacing the private sector when it comes to patient experience. And so we're not obviously the sole reason for that there, but there's leadership, there's change process, journey mappings involved, and, identification of the reasons that, veterans were not trusting the VA, and they've had a tremendous turnaround within the system. And so something is complex, and from an IT security perspective, the things that we were able to accomplish there. And then, population health management, success as well, with interventions with veterans with, crisis, suicide, homelessness. I think to date, they've had 2,800 interventions plus by, listening to veterans and having that two-way communication feedback ability and real-time feedback. So, quality, safety, improvements, trust scores, and everyone has some, has some interaction with the VA or with veterans or with the military in the country. I know I did my orthopedics training rotation there. So to see that, it's awesome.
Yeah, I think that's a great example, a really great example, where there were actual challenges that had to be solved for, and get yourself onto the other side of that. A couple other questions that have come in here. When you think about the focus on patient experience, do you feel healthcare was a little late to the game in getting into that space? If so, why do you think that was? Curious your opinions on that thought.
But I do think we have been a little late to the game. I think and I think, Greg, you mentioned it earlier, just thinking about healthcare, many people are not, at one point in time, were not choosing to come to us, right? They were coming to us because they had to. And so we sort of had that mentality, I think, for a while. They have to come to us. They really don't have a choice. So, it is what it is, so to speak. And I think we have gone on a journey in healthcare, many of us, around, yes, it does matter. They actually do have a choice, and more choices than ever before, including looking at high deductible plans and people choosing where they're going to spend their resources. So yeah, I do think we were late to the game. And I think, honestly, I think we're still on a journey. I think we still have some that are still challenged around, I'm here to save lives, I'm not here to make people happy. You hear that kind of terminology. I think we still have some challenges out there around that phrase, but also recognizing the connectivity around patients who are satisfied, are more engaged in their own care. Defenses are down, they hear your instructions, they're more compliant, better outcomes. So we still got some opportunities there.
I'm gonna take a piece of this question around creating buy-in and challenges you may have from service providers, and having both been service providers in the industry. I think this marries well to what you had just said. There's folks who went to a lot of school and a lot of education and are brilliant people, and hearts are absolutely in the right place, but they have a very scientific mind to keep someone alive, to ensure that they have a great livelihood ahead of them. How do you help bring on board and get buy-in around a very conceptual type of space sometimes, where trying to explain how we're going to do all this information with data and build these journeys, and it may not be exactly how everyone's brain is wired to consume information. How do you create greater buy-in with some of the practitioners out there who may not quite see that picture yet?
You want to chime in first?
Yeah, and so as oh, go ahead, Toni, go ahead.
Go first, I'll come in next.
Okay. So, as a provider, myself, it's never my fault. It's the guy down the street that's, providing the bad experience, or, it's the parking lot issue, right? That's what a surgeon of mine that I worked at IBM with would always say. It's never his problem. But I think, creating that buy-in stems from, utilization of, at least from a technology perspective, of making it easy, decreasing the swivel chair perspective, coming in and identifying, hey, what am I doing well, and starting, potentially there. So, releasing positive feedback, buying that, getting that buy-in from a cultural perspective to where, let's let everybody know what they're doing really, really well. reinforce that, and then start bringing in some potentially, detractor comments of, hey, what can I improve upon myself? And again, I think it's a lot easier from a provider perspective, to your point, having all the education, knowledge, and interaction with patients, to where if I'm able to see it myself, I can self-coach. I don't have somebody, barking at me about the star ratings being, low, and it was my fault, let alone it was the billing department that, did something wrong. Right. So, being able to parse out those open-ended comments from feedback and going through that unstructured analysis with that, I think is important. And so, and what we're seeing from a provider perspective is that for, our customer base, when providers are logging in, their NPS scores are much higher than their colleagues who are not. So to Tony's point earlier about the mobile engagement that we have, our mobile engagement rates are between Facebook and Twitter for utilization from customers' perspective. So if we can get buy-in for folks logging in themselves, self-coaching, identifying personally areas of improvement, it's something you want to make sure that your patients are happy about, because you want to see them back again and not go to somebody else down the street.
Yeah, I agree with that. And I think, for me, one of my big areas in the past has really been around connecting the dots for caregivers around patient experience and quality outcomes, and really being able to help them see that many of those questions that we're asking around understanding your discharge instructions, do you know your medications, do you know your side effects, and being able to show them how that connects to better outcomes for the patients and families that they're serving. And so, I think even now, kind of to Jeff's point, being able to see that even mobilely on their devices is a awesome way to get them engaged. You often hear from them because we will be showing them lag data. So we're showing them data that's 30, 45, 60 days old. And many times we're hearing, so what does it matter now? I mean, there's no way I can correct it. It's already happened. And so I was just telling this story the other day. There's a physician over at Atrium Health, and they're one of our partners. And one of his aha moments was logging in on his phone, opening the app, seeing he's in the urgent care, seeing feedback from one of his family members. And the patient said that they disagreed or didn't understand their diagnosis. And so within 24 hours, he had called this person and talked to them about it. They understood, they got some clarity, felt comfortable with it. So you talk about improved outcomes, not only compassion and caring, but increased compliance. On the physician side, yes, I've accomplished what I set out to do when I engage with patients. So I think really being able to connect those two around experience and improving outcomes.
Those are great examples. I think that's a great example. Someone didn't understand their diagnosis. Now they're sitting at home. God knows what's going on in their gut, and the emotion that's tied to that and how that impacts family, and the fact that they were able to quickly, within 24 hours, call back and provide that clarity must have been a huge relief off of someone's shoulders to, at least understand what a path looks like. That's huge. That's really important. I've got two more questions I'm going to ask from the Q&A, and then I'll ask you a wrap-up question here. Can you give some examples of what kind of unstructured data that you've mentioned is being, pulled in and aggregated by Medallia in order to help see the bigger picture? I know this is pretty custom based on, each organization as you guys build a solution for them, but what are some examples of some of that unstructured data that you've helped paint a bigger picture with for an organization?
So in my limited knowledge, I'll start with my limited 4-week knowledge, and then Jeff can chime in, but I'll tell you the piece that I thought was so impactful for me. And that was the comments themselves, getting the actual comments in from the patients and family members. In my past, we've gotten those comments. Yes, they come into a file. If I don't have a team member who is designated to sort through those, then one, I'm already getting them 45 to 60 days late anyway. And so, Greg, you may have put on there, I have questions, can someone please call me? Well, I'm looking at it, at least a month later. And if I don't have someone designated to look through those comments, we may miss it anyway. And so one of the things that really drew me was the platform where I could see those comments and not just see them. They would show me the themes. We can show you the themes around those. And so you can really drill down and see what are those comments telling me, what are my patients saying, and see that in real time. And so for me, that was a huge win.
Jeff, anything you want to pile on to that?
Yeah, sure. I'm trying to go in the Q&A section as well, and maybe take a little different perspective if the questions related to what kind of unstructured data. So to Tony's point, we can take in, comments, open verbatims, we can take in speech, we can take in video, but we can also take in, chat logs, emails, CRM data, all the call transcripts that an agent, enters in, integrations with, from an HR perspective with the HRIS system. So again, I think our, 80% of the data that comes into Medallia is non-survey information. And, our average customer, I believe, has 25 points of integration. So, if it's the kind of data we're pulling in, there's multiple areas we can pull in to paint that larger picture for, from a patient journey perspective, and providing that 360-degree view of a patient. So that's what I'll tack on there.
Yeah, and being able to provide or have for a patient their lifetime satisfaction level with you, and where exactly you've had gaps or opportunities to be able to custom that or customize that experience for them is really important. One more Q&A question, then I'll have my big challenging wrap-up question for you both. Any recommendations on books, websites, resources to go to for those that may be interested in exploring a little bit more in what's happening today in patient experience, to learn more? Are you all doing some educational stuff as well? Where can someone go to get more information?
So the one book that I read that was recommended to me when I joined Medallia was Reframing Healthcare by Zev Newworth. He's a physician out of Charlotte, North Carolina. And so that's an awesome book on, a lot of different angles that, he takes from an industry perspective as well as quality perspective, and, where he thinks healthcare needs to catch up. So I would say that's, if you're going to read one, read that one.
Yeah. And I think, Greg, you're also, yes, our site does have lots of information and case studies on there. There's some mastercasts on there. So we do have those on our site. And of course, you can always reach out to Jeff or myself, and we'd be happy to, send some stuff your way. The Barrow Institute, if you're not looking on there, awesome all around patient experience. Jason Wolf is the CEO there. And you'll find white papers and just numerous articles, materials, webinars on there that can enhance your growth.
Excellent. All right, the most challenging question now that I have for each of you. Toni, we'll start with you, then we'll go to Jeff. As everyone has been working from home, you've now onboarded virtually. Toni, I'll be very specific to you because I think this is a great example. And Jeff, I'll kind of give you the more higher reaching question here. But Toni, talk to us about tips you have for people who may be onboarding into a new role amid a pandemic virtually. What's your experience been like, and what tips do you have for them?
Yeah, so I have to say it's been really good. I was nervous about what that would look like, having come from a healthcare proper, kind of setting. So everything has been virtual, but people have been really engaged on Zoom. We do continually actually use our video, and I really like that. I feel like it makes me feel a little more connected with people versus when, I'm not using the video portion. That's been really good. I feel like there have been lots of intentional pausing and asking questions, and please use the chat. So I feel like that's been very intentional as a way, and even some of the questions that they've posed to us to respond to so that we would be engaged. So yeah, I feel like that has gone really well.
That's excellent. Jeff, father of three, you're managing working from home, you're managing learning new math yourself. What tips do you have for working from home and finding balance amidst all this this new way of life at the moment?
Create new adult beverages. Yeah, no, I think that, so it's funny because, I'm usually outside under, in Southern California, it's always sunny and, 75. So it's my kids are learning online. Fortunately, I think in 2 weeks going back on site. And so my daughter's, taking over my outside office space. My wife is usually inside working where I am right now. So it's kind of this, ping pong game of who's going to be where. My son's upstairs, on his. So I think that, just adapting and, being open to that change. And, in all actuality, it's, I traveled a lot. And so being able to be home and help my kids out and, get them breakfast in the morning and get them ready for the start of their day has been, a definite positive experience for them. Because I mentioned to my daughter last night, like, hey, I may not be able to help you a whole lot when I have to start traveling again. And the look on her eye just went, oh my gosh, it's not even in her wheelhouse anymore because she's so used to, being home, me being home. So I think just, getting used to this and finding the positives in it. And I think that for sure has, been a welcome, aspect of COVID for me and, my family.
That's great. That's excellent. Well, Toni, Jeff, thank you both for joining. I think this was a really great conversation. Again, please feel free to connect with Toni or Jeff on LinkedIn. If there's additional questions that you may have, feel free to reach out to them. But thank you both for the time, the great dialogue, discussion. Really, really appreciate it.
Thanks, Greg. Appreciate it. Thanks, Toni. Good to see you.
Yeah, good seeing you too. Bye.
Thanks, everyone, for joining us. Have a